Hi friends, Dr. Tim Garcia coming from my Wellness and Pain Center here in Port Hueneme. We service all of Ventura County, and today we're going to talk about automobile accidents. And automobile accidents, it's very common to have injury to the spine, and especially the neck, because the head is so much heavier in relation to the neck. And so when you have an impact with a large car hitting your vehicle, causing motion of your spine, you actually get translation or movement of the vertebral joints, and so much so that you could have trauma and injury and micro tears to the ligaments, the tendons, and depending on the severity, even the nerves. And so this is a picture on the board we have of a normal spine. This is called the cervical spine, which is the neck. And so normally you will see a curve, which is very gradual. You will see regularly formed and smooth vertebrae, and you will see spaces, regular spaces for where the discs live. And so this is normal. So when you have a car accident, the first thing you will see is an abnormal curve. So this next slide will show you an early changes from a minor incident. This is not necessarily here a car accident, but it's just to illustrate when you do not have normal curvature anymore. The first thing you notice then, of course, is loss of curvature in this area. So when you have loss of curvature in this area, you're going to have more pressure on those joints, and the way they move, you're going to have irritation and aberrant motion. Over time, that irritates the joint. You may have inflammation, but understand, if it's not corrected by a proper health practitioner who specializes in these things, in muscle and bone and manual techniques, then you won't have proper alignment. So it needs to be realigned, readjusted. And so this is an early subluxation or an early change in the spine. If that's not corrected, then it becomes worse. This next slide shows you early degeneration of a vertebral joint, as evidenced by these arrows. You see decreased disc space in this level, and you also see lipping and spurring and calcium formation at this level. This happens to be a true case. As a 24-year-old gentleman came in complaining of neck and shoulder problems. So the x-ray was obtained, and it was determined there was a beginning of degeneration at this joint level. This gentleman elected to discontinue care after a couple weeks because he was feeling better, but he didn't understand that the alignment and the motion and the strengthening of the spine continues after symptoms are gone, and so he dropped out. Unfortunately, 2 years later, he comes back, and this next slide shows him 2 years later, and you see it's much worse. You have very much straightening of the spine. You have decreased disc space, even more so, resorption of the disc, degeneration of the disc, but you also see deformation of the joints. And so this is starting to become advanced. It's degenerating over time. For a 26-year-old, he doesn't look too good. So the good news is your body has an amazing ability to heal and repair itself, but you have to take away the interference. And the interference here is from the arthritis in the spine, the bone's out of position, interfering with the nervous transmission that tells the body how to heal itself, tells the body how to maintain health, and to also be in absolute health all the time with proper nervous transmission. This could actually get worse if it's not fixed, and this next slide shows an advancing degeneration of the spine. This is not the same patient, but this is an example of what does happen when you're not properly treated by the proper authorities on spine and muscles and vertebrae and nerve roots and nervous system through the spine. And so you see much more degeneration of the disc. You see bone on bone in here. You also see much more deformation of the joint, of the bones, of the vertebrae. And so this is a problem. This one, when it's bone on bone, most likely it will not have a chance to recover. However, we still see people like this in this office. It's about controlling the pain. It's about improving outlook, and obviously, so these situations don't become worse, because obviously that can also happen. So when you're in a car accident, it's very important to be checked by somebody who specializes in this, as we do in this office. Understand we have 20 years experience. We have a lot of therapies we do here. But if you're in a lot of pain, I would say ice it. Ice it when you have acute pain, or the first 3 days of a car accident or an injury. And then after that, you can start using heat. But after 1 or 2 days, make sure you maintain motion, because if you don't, you're going to have scar tissue forming in the joints, and you don't want to get to this stage. So Dr. Tim Garcia here at Hueneme Wellness and Pain Center. If there's any questions, please don't hesitate to call us.